Non-profit hospitals that quietly sue patients over their unpaid bills are now under scrutiny. Mosaic Life Care in Missouri has started forgiving debts. They've stopped suing their low-income patients. This is following a national investigation by NPR and ProPublica that has prompted further scrutiny by Senator Charles Grassley of Iowa. Now, this particular hospital, Mosaic in Missouri, overhauled its financial assistance policy. ProPublica, who did the investigation, they've since found numerous cases across the country of non-profit hospitals. They pay no income tax, but they file lawsuits by the thousands, collecting money from, in particular, low-income patients. Now, Senator Grassley, he did come out and he said that this hospital, Mosaic in Missouri, they do deserve credit. They're doing the right thing after their practice was scrutinized. But he said, you know, it's also very sad the fact that it takes press attention to ensure that these companies that are tax exempt charitable organizations are not focused on their mission of helping those in need. And really, these hospitals that are non-profit should not be in the business of aggressively suing their patients. That's what Charles Grassley had to say.
They're not being so charitable, even though they want that tax protection to avoid paying those heavy taxes. It's surprising that Chuck Grassley would come out swinging. You know, he's a very conservative member of the Senate, and for him to fall on the side of patients, you know, he did, however, praise Mosaic and say that they were doing the right thing eventually. Joe, this is such a hot topic right now because so many people in this country, they're not insured at all, or they're underinsured, and you could actually lose your house. You know, I remember covering cases where people have lost their homes because they can't afford medical bills, and this is a major issue. But it's disgusting that it takes national press attention for hospitals to step up and do the right thing and not go after and sue people for their livelihoods because they can't pay a hospital bill.
Absolutely. It ruins people's lives. You can have people on $10 an hour who have a family, who want to one day put their children to university, and some kind of an accident could absolutely ruin these people's lives. The University of Michigan Institute for Healthcare Policy and Innovation did a national study last year. They found that less than half of the 1,800 hospitals they studied were even telling patients if they had any kind of financial assistance policy. So some of these hospitals, they do have a financial assistance policy, but they're not even bothering to tell their patients about it before they start collecting the unpaid bills from them and obviously ramping up the debts.
It's a despicable practice, but it looks like the story is getting some coverage, so hopefully we see this change. You know, taking this back to Grassley just for a moment, you know, advocates for Obamacare, they came out and said, you know what, this is a serious issue. You know, lots of people are underinsured. We saw him fight Obamacare in 2008. It sounds like he's changing his tune to some extent by recognizing that people need insurance even on a basic level.
It is interesting seeing a Republican do this. Mosaic Hospital, however, they have this forgiving of debts has resulted in around 3,342, that's the number we have, people receiving a total of $17 million in debt relief. That's an awful lot of money for a non-profit hospital to have been otherwise taking in. The largest bill was $250,000, $225,000, but the average was around $5,000. Still a lot of money for people who are on low income. Well, perhaps this is a precedent. Perhaps this will set a change for hospitals across the country. Non-profit hospitals, should they or shouldn't they be collecting their debts?